An AC joint is the acromioclavicular joint where your scapula meets your clavicle. AC joint sprains occur typically by falling onto an outstretched arm or elbow. There's a few ligaments that hold the AC joint together, and once those ligaments are either stretched or torn, you get this unleveling of the joint, so one side will shift up. That's called a step sign. So if you're feeling that AC joint on the top of the shoulder there and you feel this big separation or this step sign compared to your other side, then that's basically saying, yes, you've had some kind of AC joint sprain. Typically that joint will be really tender, and then you'll have pain when you're trying to reach your arm away from your body or overhead. The very first treatment I'm going to show you for an AC joint sprain is using a taping technique that will help to stabilize and offload the AC joint. So the AC joint, its purpose is to help hold the arm, the arm joint up and support it. So we want to offload that joint because the weight of your arm and carrying objects in your hand will only stretch it more. And especially soon after the injury, you want to start using this taping technique to help offload the joint and allow the ligaments, while they're trying to heal, you want to approximate the joint back together as much as possible so that those ligaments won't continue to heal while they're in that stretched out position. All right, so I want to show you how to tape the AC joint next. In order to do that, you're going to need a roll of cover roll. So this is 2-inch cover roll, and I believe it's 1.5 inches of Leukotape. I already pre-cut 2 small strips of it because we're going to do a cross technique. Now, you raise the arm up usually on a table or something that gets the elbow about shoulder height. That's really important. You identify the AC joint, which is that bony joint right on the top of the shoulder where, again, the acromion meets the clavicle. I'm going to place my first strip of cover roll from front to back. Be very careful because it does get stuck together quite easily. So I'm identifying the AC joint. I'm going to put it right in the center of that cover roll. I'm trying not to get her hair in there. And my wife was very generous to be the model for my taping today, so thank you, Helen.
You're welcome.
Then I'm going to take the other piece of cover roll, take it horizontal, again identifying the center of the AC joint, going right over top there, trying to smooth it out as much as possible. Make sure you don't go too far up onto the neck, because if you do, it's going to tug on the neck and that will not be comfortable, I promise. And then I'm going to take a piece of Leukotape, cross right over that AC joint from front to back. You want it slightly smaller than the cover roll. You don't want the Leukotape to go out onto the skin, because this Leukotape has some properties in it that can irritate the skin. That's why we have the cover roll underneath that protects the skin. It's like a protective layer. And then the other piece, we're going to go right on top here. All right, so you can see this nice cross technique with the center directly over top of the AC joint. Now, when I have Helen bring her arm down to her side, she should feel a little tug, almost like it's off-weighting the arm a little bit. Is that what you feel?
Yep, definitely feel that.
Okay, so perfect. And you don't want, like I said, you don't want too much tugging up onto the neck, but you want to feel like it's unweighting the arm. Our first exercise is a seated wand flexion. So basically, you want something that's rigid and lightweight, like a golf club or a ski pole like I have here, or a broomstick. And you're gonna grab it with about 6 inches between your hands. And for this exercise, I'm gonna pretend like my right AC joint is the injured one. So my left arm is gonna do as much work as I can let it, and just let the left one lift the right side. So my right side's completely relaxed. Keep a slight bend in my elbows as I come up overhead, and stopping at the onset of pain in the right shoulder. So if I feel pain starting here, I'll pause there, and then I'll lower it back down. Again, my left arm's doing all the work, and I'm just gonna keep going for about 10 repetitions, nice and easy, pausing at the top for 3 to 5 seconds probably. Now the goal is that we're restoring the range of motion. So you're going to have pain when you raise up to a certain point, and by using your left arm to off-weight the right one, we should be able to improve that range of motion because you're not actually lifting using the muscles in the right shoulder. Now the follow-up exercise is seated abduction with the wand. So abduction is basically out to the side, and all you have to do is grab the end of your wand this time with the injured arm and use the opposite arm to raise it out to the side. Again, the same rules apply. So you'll stop at the onset of pain, pause for 3 to 5 seconds, and then back down. And we'll do that for 10 repetitions. Okay, so our next exercise is shoulder shrugging. This exercise targets the upper trapezius, so that's that muscle that does the shoulder shrug. And we want to target that muscle because it's the biggest muscle group that will support that AC joint directly. Now, when deciding on what weights to use, I've grabbed 10-pound weights, but if I had a patient that whenever you gave them a 10-pound weight, if that just caused pain just holding the weight itself, then I would certainly drop down to a weight that you can hold without pain. So that you can start off at 3 or 5 pounds, that's totally fine. So just find a weight you can hold pain-free and shrug your shoulders directly up to your ears, kind of pinching the ears to the shoulders, and then back down for 3 sets of 10 of the shoulder shrugs. Our next exercise is an advancement of the original shoulder shrug. So I've got 3-pound weights in my hands, and if you can't raise your arm overhead yet without minimal pain, then don't even try this one. But I've grabbed 3-pound weights, I'm raising it overhead, and then I'm shrugging my shoulders directly up as if I'm touching my ears with them, and pausing at the top for just a short couple seconds, back down for 3 sets of 10. If you can't do the 3-pounders, you can certainly just do the arms, and even just the arm weight is certainly a good challenge. Our next exercise is a wall walk. So we're going to use the pads of our fingers, and it's really important that you use those pads of your fingers to climb up the wall. So the fingers are going to lift the arm up rather than just standing here and sliding the arm straight up where you're using all the muscles in your shoulder. You're going to use those fingertips to climb up the wall. So my fingers are lifting the weight of my arm up to the point of pain where I start to feel pain in that AC joint. I'll pause there, and then I'll slide back down. So I'll use friction to glide back down, and then I'll restart and go back up. So we do like 10 to 15 of these, and each time we just try to climb up just a little bit further. Thanks for stopping by PT Time with Tim. Be sure to check out my shoulder stretches video next as you continue on your pathway to living a pain-free, active, and adventurous lifestyle.